So the reason why it falls, as I mentioned last time, under our national strategic plan is because it's under HIV, TB, and STIs, because our transgender people are so vulnerable to HIV. Transgender women has got a much higher incidence rate of HIV, and it's mainly because they're not accessing services. So partly the reason, it's a little bit of a oh, and here's some of our stats. So you can see there's a prevalence of 46% in some transgender women populations, which is much higher than the 12% in the general population. So with transgender men, we've got less data, and we know a little bit less about this population, but they have a lower HIV prevalence. But of course, we want them to access services also in terms of protection against STIs, etc. So HIV screening and prevention actually is no different than normal HIV. So there's no interactions between any of our ARVs and being on hormones. There's actually no difference in terms of offering pre-exposure prophylaxis, for example, or putting people on ART. But we need to get a little bit different in terms of how do we get people to actually come in. So social network strategies in terms of providing information for people that are specific. HIV self-screening is becoming an exciting option for people who are finding it difficult to come into clinics because they're nervous about the stigmatization there. And so there's and now with PIM-ART as well, with pharmacists being able to prescribe ART, this all creates some sort of possibility of engaging our transgender community. But actually, having gender-affirming care available within the public sector is probably the most important way to get people to actually come to our clinics, and they know then they are in a gender-affirming space, and they will be able to provide them with HIV prevention services. So we've got a few options, actually. Daily oral PrEP, I think all of you know, so great option. Anybody who's HIV negative and they're unsure about the status of their partners, obviously take a history in terms of practices on whether they are at risk. But I do want to talk a little bit about event-driven PrEP, and specifically for for some trans women, this might be an option. So this is kind of interesting because this is an option before they go on hormones, but might not be an option once they are on hormones. So interestingly enough, hormones changes your susceptibility to the HIV virus. I don't understand all of this very well. It's in the latest HIV clinician study PrEP guidelines. So event-driven PrEP, initially there were studies done on trans women and it looked very promising. And I'll show you in a moment what that looks like. But it might not be a good option. Daily oral PrEP might be a better option for transgender women who has been on hormones for a while. The depivaring ring, an option, I think it's becoming less and less. I think it's probably not something that's going to be very popular now that we have lenacapavir, and some of you might have seen the rollout. There's the Global Health Fund is going to be providing, it has donated a whole bunch of dosages that will be available in the public sector at select facilities in the next year. And then we're hoping by 2027 it will actually be in the budget. And this is a 6-monthly subcutaneous injection if you're HIV negative. That's got almost 100% prevention rate of HIV. So although we can't vaccinate, imagine a 6-monthly, and they're even looking at a yearly intramuscular version that you take, and then you are covered for HIV. So amazing. So I've mentioned the daily oral PrEP, so very good option, and we do need to talk to our patients about this. But hookup sex, and transgender women might ask you about this, is when you just take Truvada, the tenofovir FTC preparation. You take 2 tablets between 2 or 24 hours prior to intercourse. So say you're going to go Pride on a Friday night, you're going to go to a party, you might get a hookup. You'll take it 2 hours before you go out. And then if you do have a hookup that night, you'll take 1 tablet 24 hours later, and then another tablet 24 hours after that one. And you'll keep doing that. If you had another hookup on the Saturday night, then you'll keep on having those 2 days after the intercourse. And I think you can do that sort of up to a week. So this we pushed very strongly for our transgender women. But as I've said, the latest guidelines is actually saying so this is particularly for anal sex. It's not recommended for genital sex, for vaginal sex. But with the hormone therapy, trans women on hormone therapy, this might not be an option. The daily PrEP is still better. And obviously use condoms. Thank you very much. I just want to see if there's any last questions.